Hey, how you doing there? Dr. Jeremiah Holmes, the owner and CEO of Core Health Centers. I want to welcome you to your new patient consultation exam. Welcome to Core Health Centers. First, I want to kind of get you acclimated to the environment that you're in and kind of bring down your anxiety by explaining some of the things you might be seeing and hearing here in the office this way. Now, you're going to see everything's kind of open. We do that for two reasons. The first reason, we want to educate our patients. See, you may have a question or somebody else in the office may have a question, and when the doctor answers it, everybody here gets the benefit of hearing the answer, increasing your level of education around your healthcare. The next thing is we want to be able to monitor each and every one of our patients doing their rehab. This ensures that you're doing it right and you're maximizing the benefit of your care while in the office. So you're gonna see this open so the doctor and the staff can watch each and every patient do their rehab. Now, this right here is our rehabilitation area, and it's open, wide open. You're gonna see all kinds of different therapies in each clinic, and it may be set up a little different. You're gonna have pre-core stretchers. You're gonna have our vibration plates here in the background. You're gonna have our neck cervical traction. You can see on the wall there. Our wobble chairs right here, and our thoracic rolls back in here in the back. Now, the doctor is going to recommend one or multiple of these or even all of them depending on your health care and spinal care needs. So be looking out for that. Now come over here. This is our chiropractic adjusting area. This is where I spend most of my time as the chiropractor, and probably where you're going to meet your chiropractor here very soon. And we use state-of-the-art Omni drop tables with 5 specific drops. And you're probably seeing the chiropractor work on these tables and hearing a lot of noises like this. And it sounds pretty volatile and harsh, but I assure you it's very, very light and very simple. These tables are so cool. They allow us to see pediatrics all the way to geriatrics and everybody in between. Very smooth, very smooth. Now come on this way. We have a state-of-the-art note system called ChiroTouch, and this is for your benefit as well as the doctor. See, your x-rays are gonna be here, your diagnosis, your treatment plan is gonna be here, as well as exactly what adjustments you're gonna be receiving to get you out of pain and getting you back to your life. Now come on this way, Scott. It's interesting. When we have new patients coming into our clinic, there's one thing that everybody has a massive anxiety about. It's like, where's the bathroom? So I want to assure you, ask your staff member inside the clinic where the restroom is to bring down that level of anxiety, because I assure you we do have a restroom that is available for you and your family to use. Now come on back, we're going to go into our digital x-ray suite right back here. Now, as we're walking back there, I need you to get prepared to answer 2 questions. The first question is, how did you hear about Core Health Centers, and did somebody refer you in here? And if they did, we want to get their name and give them a big high five next time they come in for taking your health care into consideration. The second question is, I want to know if you were under chiropractic care before and what your experience was with that care. Now come back here, let's go see the digital x-ray suite. Most people don't know how rare this is for a doctor's office, more or less a chiropractic office, to have an on-site digital x-ray suite. So this allows us to get our patients seen faster. We can take an x-ray within 8 seconds, we can have the image up. This also allows us to start treatment a lot faster here at Core Health Centers. Now, come on over here. A little background on Core Health Centers I want to tell you about is we have a vision and mission that every human being deserves to live a pain-free life, and that includes you. So if you're sitting here today with pain, I assure you we're going to do everything in our power to help you move from in pain to out of pain. See, we have a massive goal here in Kentucky and West Virginia, and we call it Keeping Kentucky and Keeping West Virginia Healthy. And that rally cry is wrapped around getting people out of pain without drugs and surgery. And we do that by focusing, laser focusing on the spine and the nervous system. See, most people don't understand. They hear about the nervous system, but they don't understand how vital it is to their health. So your nervous system, your brain, central nervous system, and your spinal cord and all your spinal nerves are controlling every cell, tissue, and organ in your entire body. Nothing can function inside your body without your brain sending a message down your spinal cord, out one of your spinal nerves to tell it what, how, and when to do its function. So as you can see, it's pretty important. Now here in our office, we look at something that kind of interferes with the nervous system. That's called a vertebral subluxation. I know you heard it. It's a wild word, but we call subluxation in this office. So part of today's visit is we're going to be identifying if you have subluxation in your spine or gross subluxation. But what is a subluxation and how does it interfere with your spine or your nervous system? Well, what a subluxation is, it's very simple in concept. It's where a bone in your spine moves left, right, up, or down 0 to 5 millimeters. So very, very minute. And when it does this, it puts direct pressure on the spinal nerves that are coming off your spinal cord that are then spider webbing out to whatever cell, tissue, and organ it's telling what to do. So this you can see is a major problem. It's almost like kinking a hose. Water without a kink comes out of the hose, right? And you kink the hose, it interferes with the water flow. So think about that like the messages going from your brain down your spinal cord, out that nerve that now is being affected. And if this happens long enough, it leads to disease or a lack of function called dysfunction in your body. So you're probably sitting there like, why have I never heard of this? And we completely understand that. That's why you're gonna feel us really educate you through your process so you can make great healthcare decisions for you and your family. Now, most of the time, people are saying, well, how do I get these subluxations? How do they exist in my life? And we understand it. So we break it down into 3 categories: traumas, toxins, and thoughts. Let's start with traumas. Traumas, major traumas like a motor vehicle accident, which might have brought you into our office, or a micro trauma, sitting repetitively at a desk or pulling down a lever. These are micro traumas. These cause muscles to go into spasm and bam, your bones are pulled out of place, subluxation. The next one is toxins. We're nothing but a big bag of chemicals, as you know. And the food we're eating right now has become just compromised with chemicals. The water we're drinking, any of the fluids that we drink are compromised with toxins. And when those are brought into our body, right, we have reactions and our spine gets pulled out of place and subluxated by those muscles going and interacting with those chemicals, and bam, subluxation. Bone moves out of place. Now we're interfering with the nervous system. Bad. The last one, we've all heard it, stress kills. And thoughts is the last category. What we think, it creates, and most of you know when you start getting stressed out, you're having those heavy negative thoughts, your shoulders start going up or your low back starts tensing up. And man, when that muscle gets tense, it pulls those bones out of place and bam, subluxation. Now you have an interference with your nervous system, not allowing your body to heal and function well. So now I hope you understand what we do here at Core and why we're so adamant about letting you know how and what we do and go about getting you out of pain and back doing the things you love. So what can you expect today here at the office? The first thing we're gonna do is the chiropractic technician is gonna come in and do a full consultation. What's going on with you? How did you come about with this? What accidents or what traumas have contributed to your painful condition that you're coming in here today? The next thing is they're gonna start an orthopedic neurological examination on your spine. Then the doctor is gonna come in and finish that entire examination. And then third is gonna recommend what x-rays will be taken here in the x-ray suite so we can get an exact image of what's happening with your spine through your consultation exam, and then have direct images of your spine so we know exactly what we need to do to get you healthy. The last thing we're gonna do is schedule you and your spouse or significant other or anybody that helps you make healthcare decisions to come in within 24 to 48 hours so we can do a full out report of findings, which we're gonna put your x-rays on a screen and show you what's causing your condition. What do we see is the major problems in your spine, right? Most doctors just hand you a piece of paper. We're actually gonna take you through it. Like anything else, if things aren't fixed, they get worse. And then what the doctor's recommendation in your clinic is gonna be to help you get out of pain and get back to life. So once again, I wanna thank you for coming into Core Health Centers and taking the opportunity to put chiropractic in your life. I know it's going to change you and your family's life forever.